stands for P stands for protect, stands for icing,
Yeah.
R stands for rest,
Yeah. C stands for
C
compression.
stands for compression,
E stands
E
for
stands for
elevation.
elevation.
Yeah.
So first of all, we try to protect the
The
injury.
surface. Yeah.
Yeah, we try to protect the injury by isolating it or by covering it or by disinfecting it with a sanitizer
Yeah.
to prevent any infection.
If it's an open
Yeah,
injury, we disinfect with
yeah,
sanitizer.
to prevent the further infection. Okay,
Yeah.
then we will do rest.
Yeah.
That's
The rest,
yeah,
for open injury, we can disinfect. But if the injury is not open, then what we have to do, we protect in other way, like giving some cast, giving some splints, so that the patient will have the surface being protected, all right, or the limb being protected, all right. Now coming to the rest one.
then we have ice. That stands from I. So in icing, we do 10 to 12 minutes of icing to prevent any swelling
Yeah.
and reduce the pain.
Yeah. Um, icing parts is very essential. 24 to 48 hours. Patients should use ice so that they will prevent swelling, decrease the pain, because most times ice helps in blocking the pain signal to the brain, nerves, voila. All right. So prevent the pain transmission to the brain.
Then we
Then,
have C. C
yeah,
stands for
for
compression.
compression. Yeah.
So we do compression in order to prevent if there
Swelling.
is swelling present, we do
Yeah.
compress the area
Yes.
to help to decrease the swelling.
Yes.
And then finally we have E, that stands for elevation.
Elevation.
Yeah.
So in the rest weather, what we have to do in the rest is just to ask the patient to take some rest if they are doing some activity so that they won't prolong and increase the pain. Whereas in the elevation, we can do mobility so that there will be no stiffness after 24 to 48 hours, because injury can cause stiffness in the joint. Right.
Now, pain can be further divided into two types. All right, we have the acute pain and we have the chronic pain. Guys, I know there are different kind of pains in your body. We have the pain for fracture, we have the pain for muscles, we have the pain for nerves. How can you differentiate these three pains? And we have other pain, other causing factors of pain like infections in the bone. All right, but now these three group of pain, bones, especially if you're having a fracture, then you'll be feeling a sharp pain, or you're trying to make the movement, you feel a very sharp pain, then you know your bone had a fracture in anything that happened. If you're having a radiating pain, like for example, this is my hand, I have a pain here, but if I touch here, it's paining me. If I touch here at the middle side, this is where it was, but if I touch here, it's paining me. And most times, not only that it's paining me here, if I touch to the forearm, I'm still feeling pain. And if I touch to the finger, most people I used to see, they have something called numbness. They touch it, they feel some electric shock or something, then they're having nerves issues. I'm not 100% sure for you, but you have to check that out. That is nerve kind of pain, all right? So you can come to the hospital and get diagnosed completely. Now, that pain we're talking about that is radiating to the side, it can start from the neck mostly, especially, all right? Sometimes from the legs, that is by the way. Then coming to the muscle pain. Now, for example, I have a pain in the muscle. It will just be in only this area, and we call this kind of pain the dull kind of pain. Right, so that is for the muscle. So in case you're having this dull kind of pain, you can have issues whereby, like for example, the most common part is that you want to elevate your shoulder, you feel pain, you can't do that. You want to, especially keep your hand in this aspect, we call this empty count tests of supraspinatus. You're pushing your hand up, you feel pain, you can't go more than especially 20 degree. Then we have the other where the dental display arrow, that is by the way. All right.